Welcome to another installment of Medical Bites. We will be going over the cranial nerve assessment for physical diagnosis 2. For cranial nerve 1, we are assessing the olfactory nerve. We will start with 2 cotton swabs that are treated with either chocolate or coffee or any other 2 distinct smells. The test is then performed as such.
Please plug your right nostril. And what do you smell?
Coffee.
And plug your left.
Chocolate.
Cranial nerve 2, the optic nerve, is assessed through several means. The first we will demonstrate is utilization of the Snellen chart. The Snellen visual acuity test is commonly done with a chart held at approximately 20 feet from the patient, checking alternating eyes. For the demonstration purposes today, we will be using a Snellen chart that is available through an online app on a patient's phone. This is held at 3 to 4 feet from the patient's eyes and can be read in a similar manner. This is the common Snellen chart. You would have this placed at the appropriate distance for the size of your chart, either on an app or on a wall, commonly again at 20 feet. You would then ask the patient to read the line that they can best read, have them read 1 line above, and then 1 line below. You would then notate what line and then their visual acuity, which is on the far side, either 2200 to 2020. The exams should go something like this, with the handheld app Snellen chart held at arm length.
You can cover your right eye. Read the smallest line you can read.
T-H-O-V-O.
And can you read the line above it?
H-T-O-V-T.
And the one below it?
O-T-V-H-T.
And can you switch eyes? Do the same thing, the smallest line you can read.
T-H-O-V-O.
And the line above it.
H-T-O-V-T.
And below it.
O-T-V-H-T.
Cranial nerve 2 can be further assessed by doing visual field testing. In this case, the provider will stand in front of the patient with the patient focusing on the provider's nose. They will then move through the 4 areas of the visual field, asking the patient initially how many fingers they see. They will follow this up by asking them how many fingers total they can count in the upper fields and total that they can count in the lower fields. The exam will go something like this.
If you can please focus on my nose and tell me how many fingers you see.
2. 1.
Now can you add them?
4. 3.
Assessment of the second cranial nerve also involves direct visualization of the retina. This would be done during a fundoscopy exam. Fundoscopy exam will be demonstrated and completed to be tested on during our ophthalmology presentations. Use of light reflex for the eyes to assess for pupillary response, both direct and consensual, is also included in cranial nerve 2. The direct light test tells us how the optic nerve is functioning, while the consensual response is utilized for cranial nerve 3. The examination for direct and consensual response goes something like this.
Right, just look straight forward.
Notice how the provider is looking in the same eye. Once at the eye the light is going in, and then once in the eye that is opposite for the consensual response. Continuing on for assessment of cranial nerve 3, we will now test the extraocular motions. The provider will move their hand in an H form and have the patient follow their hand specifically a finger, without moving their head, following the motion with their eyes. This exam should look something like this.
You could just follow my finger with your eyes without moving your head.
We assessed cranial nerve 2 with a pupillary response, and we assessed cranial nerve 3 as well with a pupillary response, checking to see if the eyes and the pupils have equal, round, reactive to light and accommodation. Accommodation is the last portion of the test where the provider asks the patient to focus on their finger while they move it towards the bridge of their nose. What you should see is dilation of the pupils and the eyes approximating so that they are looking towards the bridge of their nose in a semi-cross-eyed manner. The exam should look something like this.
Just checking to make sure that your pupils are equal inside, which they are. And if you could just focus on my fingers.
Cranial nerves 4 and 6 can be tested together when we are doing the cardinal motion for the extraocular motions. An easy way to remember cranial nerves 4 and 6 is SO4, LR6. SO stands for superior oblique, LR stands for lateral rectus. Cranial nerve 5 has 3 branches, henceforth it's named the trigeminal nerve. All 3 branches are tested with light touch during the examination. The exam should look something like this.
Can you please tell me if you feel this and it feels the same on both sides?
Yes. Yes. Yes.
Cranial nerves 5 through 7 can be assessed by assessing the corneal reflex. This is done by using a cotton-tipped applicator or a wisp of cotton and moving gently across the patient's eyelashes. This is primarily done in comatose patients. Cranial nerve 7, the facial nerve, can be assessed by asking the patient to do several motions which stimulate the different branches of the facial nerve in making facial expressions. The exam should go something like this.
You raise your eyebrows and close your eyes really tight, puff out your cheeks, and give me a big smile.
Cranial nerve 8, the auditory nerve, is assessed by asking the patient if the sound of fingers rubbing at the external auditory canal sounds the same on both sides. During the ENT examination, we will be further testing using a tuning fork with the Weber and Rennie tests. The exam for cranial nerve 8 should look something like this.
Can you hear this on both sides?
Yes.
And does it sound the same?
Yes.
Cranial nerves 9 and 10 are assessed by asking the patient to open their mouth and say ah. The process of saying ah raises the palate in both sides on the soft palate in order to test the nerve function. Assessment of the gag reflex is normally done during an ENT evaluation and can be utilized either with a cotton-tipped applicator or with a tongue depressor. A simple way to assess if the patient has the swallow reflex and can protect their own airway, has a gag reflex, is by simply asking the patient to swallow. The exam for cranial nerve 9 and 10 should go like this.
You could open your mouth, say ah,
Ah.
and if you can give me a swallow, perfect.
Cranial nerve 11, the accessory nerve, can be assessed through shoulder shrug against resistance or turning the head against resistance. Either test can be completed to assess for cranial nerve 11. The exam should go something like this.
Could you please shrug your shoulders against my resistance? Good. And turn your head against my hand. And other side. Thank you.
Cranial nerve 12 is assessed by asking the patient to stick their tongue out and move their tongue from side to side. Further movement of the tongue, upward and downward or side to side, can be done, although the cranial nerve function test can be assessed by simply having the patient stick the tongue out. This test is done like this.
Can you please stick your tongue out and move it side to side? And now up and down. Thank you.